and just go over the common treatments now that are used for COVID. And I'm going to start with the medication remdesivir, which we've all heard about and talked a lot about. This remdesivir is an antiviral medication that inhibits an enzyme called RNA polymerase. COVID-19 is an RNA virus, and so this does slow down the replication of the virus. Remdesivir was actually first used for viruses like Ebola, and for that reason, the University of Nebraska Medical Center took place in a lot of the early trials for COVID, and actually Dr. Khalil from the University of Nebraska Medical Center was one of the lead investigators on using remdesivir in the COVID patients. It was the first treatment for COVID-19 approved by the FDA. It was approved back in February under emergency use authorization. And since that time, it was allocated to the states as far as how you could get it to the hospitals. But right now, it's widely available for purchase by any hospital system. In the largest studies on remdesivir, it showed that it significantly reduced the time for a patient to recover in the hospital from 15 days down to 10 days. And in that same study, there was a trend, but not a significant reduction in mortality. So it trended towards a statistical significance, but did not quite reach statistical significance for decreasing mortality. We've also learned since February or March of this year that we used to use remdesivir only in the later stages of the course of the illness, like when patients were already really gravely ill and on a ventilator, but now it's used very early in the course of the illness, even as soon as a patient is found to need oxygen therapy, they'll start remdesivir treatment. So the next one is medication is called dexamethasone. It's a steroid medication, and what steroids do is they modulate your own body's inflammatory response. So rather than basically attacking the virus itself, what dexamethasone does, your own body's response to the virus is to create these cytokines and these proteins that actually try to kill the virus, but at the same time can do damage to your own tissue, your own lung tissue. And so dexamethasone tries to prevent that hyperimmune or that immune response that your body might make that it's doing to try to kill or slow down the virus, but actually also doing damage to your own tissues. So the dexamethasone has been shown to help with that. And a large...
Ryan, I think you need to advance the slide.
Pardon me?
Ryan needs to advance the slide, I think.
Oh, we have it up here, Governor. It is on the screen.
Okay.
Yes. Thank you, though. So in the largest trial on dexamethasone was done in the United Kingdom. It was called the recovery trial. It demonstrated a very significant decrease in mortality by 35% in patients that were on ventilators and decreased mortality by 20% in patients that required oxygen. Again, just like remdesivir, it's been learned that once a patient requires any form of oxygen, supplemental oxygen therapy, that dexamethasone is usually started at that time rather than waiting towards the end of the illness. It has not been shown to be of any benefit to patients that do not require oxygen, so it's generally not used as a prophylactic medication for that reason. The next treatment, and one that was used and still used to some extent, is called convalescent plasma. Convalescent plasma is what's known as polyclonal multiple antibodies that are now started to be used in August of this year for patients with severe and life-threatening infections. It's basically the plasma of a patient's donated blood that has already had COVID-19 and therefore developed antibodies towards COVID-19, therefore giving those antibodies directly to the patient who's ill. Now, this is called polyclonal because it contains multiple antibodies that that person or that patient that had COVID developed against the virus, but also gives other antibodies that that patient maybe developed with other viral illnesses in the past. So this is something that was used quite extensively and actually led to the development of the next treatment, which are called monoclonal antibodies, as the governor mentioned. This is the newest form of treatment, and a monoclonal antibody is a protein or an antibody that's actually made in the laboratory to specifically target what they call the spike protein that allows the virus to attach to your own cells. It attacks that part of the virus and then destroys the virus. So it obviously prevents the progression of the disease. Again, they've been found, and the studies show now, that it's mainly given to patients on an outpatient basis to try to prevent that patient from getting ill enough to come into the hospital. So it's given right after a patient tests positive. Within the first 7 or 10 days, it's been shown to be effective to keep that patient from developing an illness to be severe enough to be hospitalized. So it's given in an IV infusion. It will be actually given in long-term care facilities, in infusion centers, and maybe some other areas where patients can come in and get this IV infusion. It lasts about an hour. Usually you need to stay another 2 hours just to sort of watch to see if they develop any side effects. But it was just authorized November 9th, and already it's being distributed. The state is responsible for allocating this, just like remdesivir was at first. And we will be getting out our first shipment here within the next 7 days or so. So the early evidence for the monoclonal antibodies showed this to be of benefit in the outpatient setting, where it could possibly reduce hospitalization for that patient by 5 to 10%. So let's say you had 100 patients that you gave the monoclonal antibody infusion to. Hopefully it could prevent 5 to 10 of those patients from eventually ending up needing hospitalization, which would be a great thing to have at this point. And just the last thing I want to mention is about vitamin D. There's been a lot of talk about vitamin D and what vitamin D does. It also, just like the dexamethasone, it helps to modulate your inflammatory response. The studies showed that in patients that had COVID and needed ventilator therapy or ICU therapy, that patients generally had a higher risk of having a low level of vitamin D in that setting, and patients that didn't had a less of a need for ventilator therapy or basically ICU care. But what they found is that that vitamin D level needs to be up in the normal range even before you come into the hospital. So it's something that they're now saying it's probably best used right now, as we're all standing here, to be taking now. The actual recommended dose for vitamin D is 400 international units, but most people are recommending up to 4,000 to 5,000 international units now on a daily basis for vitamin D to get your levels built back up to normal. This is specifically important in our area of the globe because in the wintertime, the sunlight turns the inactive form of vitamin D into the active form. And now when we're in our winter period, that ultraviolet light that does that is not strong enough to convert that vitamin D inactive form into the active form. So it's very good to supplement it by taking that oral dose.